I'm going to do the pecs first. We'll have a shorter table than normal for the abs. So, pec major and minor. So, you do, right? What's it from?
I think it's overworking, all right, so I don't need
Okay, where is the pain?
to.
Oh, it's under. Okay, so all the neck. Okay, so this is where you're gonna be. Okay, so again, I kind of showed this in the last one, where you're gonna want this totally relaxed before you do any work. So I've kind of, sorry, I'm just kidding. I've kind of lumped in the scapula and the pecs, because I find they kind of work together. So again, we're going to want to work them together. So in all three positions that I'm showing, I'm going to be working anything that attaches to the medial border of the scapula as well as the pecs. So I'm just going to see what kind of holding pattern she has and just kind of see what range she has. So let me passively do it and totally relax. Yeah. And that's the thing, they're going to want to help you, but you're going to want to see what you can get passively. It's going to be different what they get actively, but also when you do it passively, like you can get her to do it and be like, oh great, she's got great range. But when it's passive, I can see where there's a painful arc. Or when she has a holding pattern, right? And sometimes I don't want more range, I want to get rid of the painful or the holding pattern. The range isn't so much as I just need her movements to be smooth again. So especially if she was playing a sport, whatever it is, got that in that position, don't necessarily need more range. I'm more concerned with, are there any sticky spots or areas that aren't smooth, right? So she's pretty decent there. Okay, totally take a deep breath in and then relax. So I'm just gonna push and then see where I get. And so when I do this, we all know I should see some scapular rotation, and I'm seeing none. So her rowing range isn't bad, right? It's not horrible. Totally relax the arm, right? Because I can push it, but her scapula wings after. So she's probably lack of control down here, but that's not an issue I'm gonna address in her post-event. So what I'm gonna do is, I'm gonna suspect she is already confirmed, but she's getting a winging. It's a lot of tightness up in the upper part here, and probably going to her neck. So for her post-event, that is, if I've got a certain time, that's where I'm going to wanna focus. So right here, the first thing I want to do is I'm going to actually, so my hands on the front of her chest, and I'm not just going to pull it up. I just want to see what kind of range I get from straight elevation. So relax, right? And then I'm gently going to, any pain with this?
It's only when someone puts their fingers on their...
Okay, so and that's why we use the principles of massage. So I'm starting a little broader. And then I don't actually know if with her, if I'm going to be able to kind of get pinch grabs, because I can already feel she's starting to clench, like she will. So for me right now, post-event, I'm just trying to get her range of motion back. And then when she goes to do her warm-up the next time she competes, she can work on those things. It's too late for me to try and get her lats to contract, and that's between her strength and conditioning coach. And so I'm just trying to, again, this is the thing, guys, we have to work with what we're given. You're gonna want to be a hero and gonna want to fix everything, and you have to go at their pace.
Like it lats.
Yeah, like she will probably need some strengthening at the side here just to make sure that this stays anchored. But that's not my concern, and it won't ever be actually because I'm soft tissue. In a team aspect, if it's my own clinic and I also do rehab, but the important thing is to stay in your lane. So I would try and see what I can get like this, because this is her most relaxed, and already. And sometimes that's what you gotta do, just do some work, let the body take it in, and then go back and try something else. So I can already tell, movement's already gotten better, right? So with her, you can't push it. Sports too, especially we are a bit vigorous, because they're ready to go. But post, you never know what they're gonna be like. So already, I may be able to get in. So I would just do a little bit. Again, I'm keeping it rhythmic. I like to keep it moving, because then it kind of tricks the body. If you just do it, then the time's got body to be, you've given the body time to be like, ooh, let's not, keep it moving. So I do a lot of my posts like this too. So if I had enough time, I probably would be able to get in. And she's totally relaxed now. Right? So literally, I don't want to do any more with her, so I'm just literally going to just see if I can get more elevation. Because remember, I'm going to do this in 3 positions for that reason, to get different parts, right? And the other, so I've kind of got scapular moving now, so I should be able to get more give from her pecs. So you can feel I'm in here, right? Is it painful? Okay. And literally, I'm just going to do the same thing. So I'm not I'm not clenching her arm like this. Like I don't have a vice grip. I'm literally like this. My hands are just at the side. And I'm literally just up with the pads of my hands, up. Then I'm gonna move a little further to the origin. First I start closer into the muscle belly, and then I slowly move out. Again, I'm just gonna keep it rhythmic. And when I find an area that's sticky, I'll just kind of go a little proximal to it.
She's doing like this dog pushing.
Yeah. Right? And then I will just always just test and just make sure it hasn't gotten any worse. Right? Because if that has irritated it, now I gotta switch my focus. Right? And now this is moving. Like in all different planes. Right? Like now I can actually, she's actually moving now. So when I do this, sorry, totally relax. Now I can see her scapula actually move. So ding, ding, ding in 3 minutes, I've already left her better. Again, if I got half an hour, I need to be quick with this. So I'm gonna have her on her side now. So now I also know that her restriction's mainly up here. So that's where I'm gonna wanna focus. So go on to this side for me. So I don't know how you guys do it when you have some of the sideline sports. I just move down just a little further down, and then I just take the headrest and put it on the table. There we go. And sometimes if I'm doing the legs, I'll just put it in between their legs. So now I'm gonna get you to move closer to this end. Are you crying because you're sad? No. Move closer to this side of the table. Because I'm gonna want to sit on the table.
No,
I'm gonna want to do the least amount of work possible. Okay, totally relax. So now I'm literally gonna do the same thing, but I'm just gonna hang out here, and I'm just going to, right? First I know she's got restriction coming from here as well, right? So I'm just gonna see what I can
Black moment.
So now, guys, I'm just going to do the same thing. But this way, now that I know I have movement, I'm literally just going to, and I'm leaning back.
Yeah.
Right? And again, it's rhythmic, right? She's more willing, she's an athlete, her sympathetic nervous system is firing, she's more willing to let go when her body's in motion.
Right. Yes.
And I do this, I told you, I do this with my regular clients as well. Like this is a lot of how I'll treat, right? So now we've got here, see, and this way, I can literally now, because now I got gravity, right? And what I'm doing with this hand is, I'm trying to get the top, I'm literally pushing it in, right? She doesn't even really know that I'm pushing it in. She can't feel the difference. But again, it's important when I mobilized the scapula while she was on prone, that I did some of the pec work. Because that pec work would inhibit me from doing this. Right? So that's why I lumped the two of them together. Right? So literally, relax your arm there. And now I can get in right at the top. But again, this is enough for me. Making little progress. Don't forget, we start the engine with treatments in general. And so then when they do whatever else they have to do, then it might not be for 24 hours till she feels the full effects of a massage. So now I'm gonna get her on her stomach. And so, I'm gonna do this one again. So after we've done that, actually no. I'm gonna get you on your back. I'm gonna sorry, so again here, if we felt like we needed more like subscap or wanted to go into like pec minor and whatnot, because the constriction was mostly coming from the front. So we would just turn her over. I like to do this just to see what I got in terms of her holding pattern. Because sometimes we'll go in and work a muscle till we're blue in the face and it's actually a holding pattern. Right? So always this is how you'll know she's relaxed too. Like she should just let me bounce it off the table. And also too, you can see her range. Right? So you can test it this way too, and sometimes they'll be like holding it. Well then, you need to do something else. Whatever that is, jostling, just something else, whatever you did. So she's pretty relaxed. Right? So now, actually what I'm gonna do, notice I'm going at the scapula the same way. So now I'll take it from the back. So totally relaxed. This you would do one of the last ones because they can find it invasive if they're not relaxed. So I'm at the medial border of the scapula with my hands like this. Right? Using it as a ridge. Totally relaxed. And then I'm just gonna take it and I'm just gonna move her scapula. Same thing I've done in sideline, same thing I've done front. You'll find some of your clients will prefer one way or the other. But with an athlete, I'm gonna do all three because I'm affecting different origin and insertions, right? Based on their body. So, same thing. This is going to be the most, and they're not used to getting work done this way. So this will be, so you'll want to make sure that they are relaxed. And I can see from her face, this is, so I'm on a trigger point right here. So I'm going to get off the trigger point. But I don't have time, girl. We got 30 minutes. And they're going to say that. Yes. They're going to be like, oh my God, you can just say that. And you're going to say what I did. Girl, we don't have time.
We're role playing.
There's 14 other teammates that don't. But you will, and they will say that, right? But that's for, so in all honesty, if you did have a trigger point, that's going to be my focus and something else will not be done. You know, that kind of thing. But sometimes you do have to tell them because they'll be like, oh, and then you're done, and they'll be like, oh, but my leg. They'll be like, no, your leg's fine. They'll come with all kinds of things. So
Take your leg with you.
yeah, that's cold tub or nothing. And then with this one, which we know is not pleasant, you can go in and do some skip. So anything, and she's got good range on that. This is the shoulder that you have the issues with? Do you always have good range?
I do yoga.
Okay. So, how's that in there?
That hurts.
But again, my goal, she's got enough, right? So I wouldn't need to spend any more time on her that way. Now the last thing I want to show you, turn onto your stomach, and this is a good one for if you don't have a table. So this is another way to kind of get the pecs, and you actually get the whole thoracic, which is great too. So put your hands behind your head, like you're being arrested. So some people will do
trigger me.
Oh, sorry. No. For me too. No. So some people will do it like this. I don't like that. I don't feel like there's any support. So I will go in here, and I'm going to pull her up, totally relaxed. You too. And now I'm just going to do some traction at first. But now if she's like a swimmer, or a lot of the throwers I deal with, they've got some thoracic tension. So what I can do is, and with the pecs, I know one side and the other. I can literally, right? And this is nothing, like I'm anchored. I'm like sitting my ass down on a chair, right? And then, once you feel that they're loose enough, again, this is why you would do this one last if you do, and then you can just give them, if they need more range of motion in their torso, and you need to restore it, do this on your normal clients. I implore you guys all for the next 2 weeks, go and try at least 1 or 2 things in here. Because if you don't do it right away, you'll never do it. Right? Do it with your clients you trust and be like, I just took a course, I want to try this. But this one's great for thoracic. You can like go to the side, right? And go all the way up. And this is one you can do on the floor. Now, see, with that last one, I went too far too quickly. She actually was using her back. So, just
instinct.
Yeah, exactly. So you're going to want to make sure they're comfortable enough. If you do it, they'll get comfortable enough and they will laugh. So yeah, so post-event, guys, the key for me is I've worked the shoulder girdle in 3 different positions. Like that's going to be good to go, and that's the key post-event. It's not just your normal, can't do a little bit of everything. Trying to get them ready for their next competition, right? So the stuff I'm going to show you going forward, same kind of thing. So, okay, you're good. And I'm going to do the light on? Oh, yes, perfect. Okay, so, are you okay? I know I've only done one side. Okay, I am going to start you on your back. So I'm going to kind of do the adductor hamstring. Put your head that way so you keep it consistent. Okay. And start on your back. Any injuries or?
I'm a retired runner. Just tight hips.
Okay, so this one's going to be kind of like a adductor quad hamstring complex because that's how they work. We're short on time. So what I generally do for this is, so I've done all the prep work, I've done the range of motion, I've done all the other stuff. So what I'm going to do is now I'm going to position her. First of all, I'm going to go like this, right? And I'm just going to show you. Do you have any allergies or anything? Are you okay if I pull this up? Yep. That's the other thing. In sport, we forget to ask for permissions a lot. It's just kind of implied. It's horrible, but it's the truth. Okay, so I would just start off doing some general things like this. I like to always shorten a muscle, right? So this way, I can already get it, right? And if you notice when I do this,
Feels great.
the whole point of this is, like when she does her stretching or does whatever she's doing or walking, she'll get the quads in this position, she'll get the hamstrings going straight forward. So I'm trying to get them on a diagonal, and I'm trying to get them where they connect. So my goal is, you're not gonna see me doing a lot of this. She can get that. I'm gonna go where everything connects, when the adductors and quads connect, right? So I would do that. Then I can actually go, I'm gonna take her leg like this, and for anybody that's tall, the athletes, this is perfect, right? You can do any size, any age, whatever, and then I can get the adductors and hamstrings, right? These magnets will work as a hamstring. So the fact that we treat them like this, and then go like this and try and that's not adductor work, and it won't work for an athlete. Now they're gonna have to go somewhere and get their adductors done. But I like to do it with the muscles they work with, right? So I'm gonna go kind of where they attach. I'll go high up. But the other thing that I wanna show you is using your body as leverage. So you can go, and I'm just gonna move it. Right? I like movement. Athletes' bodies like movement. You might have to readjust, no big thing. Right? Always movement. Then, if I'm gonna do a hamstring, I might just put it on my hip like this, and I'm gonna do like this.
Oh, we should be doing this in just a second.
Well, this is what I do with my clients. Like this is what I'm trying to tell you guys. It works for the athletes because I'm just using a little bit of rhythm, and I'm a little more specific, and this way you can feel the muscles. I'm not just doing 5 of these. There's parts of the hamstring I may not touch, because I don't have time, and I'm going where it's tightest. And then when you do it like this, I can find a place that's tight. She's only got this range, that's fine. I'll work with this range for now. Maybe I stay at that range. Right? And then, sometimes, you only got one position, I'll just do her hamstring like this. Right? Now I can get and I can go because she's an athlete, and I can go all the way, she'll do brassiere like this. Yeah. So it's almost like, you guys know, straight leg raise is not the best indicator of the length of a hamstring. It's when it's flexed at the hip, right? Straight leg raise is good for pathologies like disc stuff. And so literally, I'm gonna see what she has in her hamstring. But because I'm doing it rhythmically, I'm not doing some one static, okay, let's see what we got, time for her to clench. She's not even gonna know how much range I'm getting. Her body's just gonna tune it out. I'm keeping it rhythmic, right? I can move at different angles. Change my hand, my arm position. I can just keep this going. Right? So I just want you to see that. The other way you can do hamstring and adductor is I'm gonna get you to lie, I'll show this way. So lie on this side for me. Okay. So you always bring this leg up, takes the pressure off the low back. Bring this leg out, and now I'm gonna work in this position. So sometimes, and this is gonna be, if they have a contusion or something and they can't lie on their front or their back, well, there's always side lie, right? And this way, same thing, right? Do many of you treat in side line?
Yeah.
Do? Good. And then when she's not wearing this or where you're draping, you can go really high up, right? The other way is you could just, again, I like movement, so I'll just pin and stretch. And this is the rate I will work with post-event. It's slower than the pre-event, but it's still constant, right? It's still their body in motion. A lot of times they've stopped their competition, but their body hasn't totally given up, right? So you can do the quads in this position, or you can do the gastrocs in this position too. Right? So I just want you guys to get comfortable and practice that, especially with them on their back. And then, so the gastrocs, so go onto your back for a second. Go onto your stomach. My mistake. So when I talked about being able to treat the whole lower limb in this position, so start off doing like gastrocs. Again, this is the pace that I'm going at a post. It's probably a lot faster than you can go slower, like if they're in a clinic or whatever, but again, if you've got 15, 30, 45 minutes, see you want to make sure everything's. Okay, and I'm just warming up because of the other stuff I'm going to do. Okay, so when I feel like it's, there's just got a little more flexion. So I can treat tibialis anterior. So it's in the front here. I'm literally going to take it. Okay. And this kind of resets it. Right? You can work tibialis all the way up. And then what's often forgotten, like the adductors, are the peroneals. And they're very important because if the superior tib fib gets stuck, their hamstrings are going to be tight. And they're going to lose plantar flexion and dorsiflexion in their foot, and then it's going to go all the way back, probably leading to either hamstring or low back. So if they post-event have hamstring and low back, obviously treat that, make sure the glutes are firing. But the other thing you're going to want to do is make sure that you look at the foot and what's going on with the foot. And the peroneals are a very big contributor to that. So now I can do the peroneals literally in this position. Okay, and I can go all the way up. Sometimes what I'll do is I'll get her to plantar flex and dorsiflex her foot. Go, keep going. While I go up. Good. Yeah, so those are the things, and the other two things are so again, if I'm done this and they're about to leave, I'm going to probably do a low back stretch because it kind of encompasses anything. So I'm going to get you to lie on your back for me. Yeah. Good. And so this is another thing. It doesn't matter the size of your athlete. You can do this. So I'm going to get them to bend their knees. And same thing with when I had her on her stomach. You can always sit on the table. You can, like, their lower leg's never going to be that big. You're always going to be able. So here I'm going to bring her up like this. What I'm going to do is going to take my hand underneath sacrum, and I'm literally going to tip her like a teapot. And at that point, it's physics. Like now, I can move her wherever I want. So literally, this is the motion, and then I'm just going to get her to go to the side. And literally, once I get her like this, I could just have her right here. Low back stretch, and then I might just angle it. I'm going to get her to put her hands on her stomach. Right? And now, I can literally move. And to get even more of a stretch, I'm going to get you to get that arm and reach up diagonal to the other one. Nope, the other way. Yeah, and stretch. Push, push. Nope. There, that one. Yeah. There we go. Right? And while I'm here, right, I can just even pull it. If I want a little more on the diagonal, you can just pull her down. What I can also do is bring that arm in. I'm going to get you to scooch over to the table. Just, that way. Just, do the same thing. I'm going to do this. And now I'm just going to do some moves. Right? If I feel like there's a restriction, you can just get that. Right? And you can do that to end the treatment, begin it, however you want to do it. And the other one that I find effective for any thoracic and kind of like QL and lats, get her to take this, relax. And I'm going to literally cup under here. I'm going to be on this side of her vertebrae. I'm going to pin down SIS, and literally, it doesn't matter how big they are. It's a fulcrum. Right? Yeah. But then what I'm going to want to do, if I feel that or I feel restriction, now I'm going to move my hand further up that way. And then that will be the,
What side are you on that?
I'm on this side. I'm across the body.
Okay.
Right? And then I might just go back down and just see if I got any more. Right? So kind of combination moves. The real thing I want you guys to get away from it is work the entire origin insertion and where the muscles connect, like the back of the knee, where the quads attach to the adductors, where adductors attach to the hamstring, and just play with positioning. You're going to have feet, legs, or whatever all over you. So kind of get comfortable with that. So I'll give you guys a couple minutes to try that.
Can I ask you something? You did a stretch yesterday, and you grabbed the whole back and kind of pulled her off to the side.
So it was this, but she doesn't have that give.
Got it.
So that's so that's the other thing.
Okay.
She was hypermobile.
Gotcha.
Right?
Okay.
So it was the exact same stretch,
Okay.
but she won't go. I can force her,
I got
but she won't go.
I got you. Okay.
So it looks different with different people. So yeah, that's a good point. Okay, guys, so I'm going to give you some time to go through that. Anybody have any questions? If you,